exercise 4 to 5 times a day. When I did her beverage, there were half a dozen a day, and at night, a half a gallon of wine. And when I made a query about this, I said, when did you start drinking a half a gallon of wine? She told me the date and the year. I said, very interesting. What happened? Was there any particular event that was associated with it? She says, my wedding. Ends up, her husband had been an Episcopal priest, and he left in order to marry. He left, I guess, and they weren't allowed to marry. And so he left in order to marry her. But he felt guilty about leaving the priesthood, and they never consecrated her marriage, and she drank herself to sleep on that night and every other night since that. I said, how long has this gone on? Of course, I could see, 11 years. And when I suggested there was something wrong with her marriage, she walked out of my office. So you always want to ask the beverage and the food. You can do the Coca Pulse test. A nice little test. It's good for mild IgE type reactions where someone eats a food, single food usually, and then you wait 15 minutes to 45 minutes, you start taking half an hour, have them take their test. Their pulse should rise about 20 points after a baseline, and then you take it every half an hour and see how long it takes to settle down. You can observe. When I eat strawberries, my tongue tingles. Pretty good indication of allergic to strawberries. And then, of course, you can do the allergy test, the IgG delayed type sensitivities. And any kind of complex issues with food allergies, this is by far the best way to do it. And it's a blood test. So if you don't draw blood, you have to send it to a doctor that does draw blood or to a lab that will draw the blood. And you send it off to a lab. Several labs specialize in this. And you have the IgE or the IgG. You want to make sure it's an IgG lab test. Now, as far as the intestinal tract, you can do something called a digestive stool analysis. And often paired with this is something called an intestinal pathogen analysis. And these are two separate tests often combined into one, where you can see quite a few things from this. The digestive stool will tell you if the food is being digested properly, if there's sufficient fiber in the diet, if there's excess mucus in the stool. They'll tell you how well the food is being digested, the absorption of fats, including long-chain, short-chain, medium-chain fatty acids. It'll tell you the stool content of the cholesterol. If there's blood, it'll tell you it's difficult to see a small amount of blood in the stool. So it'll tell you if there's occult blood in the stool, and that'll give you an idea about intestinal leakage. Oftentimes one of the subtle ways of determining anemia in people. It'll tell you if there's signs and symptoms present of inflammation, and it'll give a different indications of immune function depending on the lab. It will also tell you if fecal secretory IgA is present, if it's low or if it's high. If there's sufficient friendly bacteria by the kind of intestinal environment there, such as the butyrates involved. It'll tell the pH of the bowel because we have an ideal pH that the bowel likes to function at, and it's different in the large bowel than the small bowel. If friendly bacteria are present, are they present in the proper ratios? Do they have the proper food that they need to feed on? The intestinal pathogen, and then you can also do the pathogen analysis, and what that will do will tell you if there's any pathogens. And they usually analyze for bacteria, fungi, parasites, such as protozoa and helminths. And most of the labs, not all of them, can do a sensitivity and resistance to the bacteria at least, and sometimes to the fungi. So they'll isolate the bacteria, and they'll grow it, and then they'll expose it to different natural and pharmaceuticals, one at a time, one in each well. And they'll tell you whether they're sensitive or resistant to that particular agent, so you'll know what to use to kill it. And it's very, very helpful to know, especially with some difficult bacteria that the person you've tried to treat several times and it didn't seem to work. You'll find in that case the magic bullet. before, I only use laboratories that specialize in these kind of specialized stool analyses, both the fecal analysis and of the dietary kind and the kind that do the pathogenic analysis, because the others really aren't worth your while, and they often mislead you thinking nothing's wrong. They give you false negatives when they shouldn't. You can also call the urinary organic acid profile, which is a urine test, and they have different kind of indicators of overgrowth in the bacteria. Here's the difficulty. With a stool sample, you mainly get what's going on in the large intestine. It doesn't give you a very good idea about what's going on in the small intestine. But the organic urinary analysis will tell you what's going on in the small intestine. So you get a better marker for bacterial overgrowth, mainly. It's not specific. It doesn't tell you which bacteria, but it'll tell you that you do have a bacterial overgrowth. And then there's some general treatment protocols that you can go through that will eradicate that. You can retest. You can see the difference. Then you can also do the methane breath test, as I said. That typically that's going to be for a bacterial imbalance in the small intestine. And you simply blow into a little tube, send off the sample to the lab. They'll tell you whether the person has increased methane. If they do have methane, then that means that kind of bacteria is fermenting in the bacteria, because we don't usually have bacteria that produce a lot of methane in our gut. So if you do have bacteria producing methane, it's the kind you don't want in your intestinal tract. Once again, it doesn't tell you, but it does tell you it's a problem. And it does tell you what's going on in the small intestine, and that's difficult to analyze. You can also do the leaky gut syndrome test, and it's a very simple test. You got two molecules, lactulose and mannitol. Mannitol is smaller, lactulose is bigger, and mannitol will fit through the intestinal tract very easily. Lactulose shouldn't. So you just feed the mannitol and lactulose, wait a while, collect the urine, and if you get both lactulose and mannitol in the pee, then you know you got holes in your intestinal tract because lactulose that didn't go through there ended up in the urine. And if you have high mannitol and low lactose, then you know that you did a good job, your intestines are doing a good job, and you're not having leaky gut syndrome. Very easy. Now, there's other laboratory tests you can do to treat in the AIDS treatment of autoimmunity. They're not tests to take the place of any other autoimmune test. Like, for example, this doesn't take away from the ANA or other kind of tests you're going to use for autoimmunity. But these are going to be in addition to help you better diagnose and treat the problems with people with autoimmunity, which are plenty. I would suggest, first of all, just do a plain old fasting metabolic panel, the SMAC, the Kim panel, metabolic panel, whatever you want to call it. Just do a SMAC with a CBC. In addition to that, do the steroid hormones, the salivary hormones, because that's going to tell you where cortisol and the other estrogen, testosterone, these others, whether it's going to tell you about TH1, TH2 propensity. Then urinary catecholamine catch, and you're going to know about norepi and epi. And then do the serum thyroid test. But first of all, do a basal body temperature test. Have them lay down before they ever move in the morning. Put a thermometer in their mouth. If it's below 70 and 97.8, then do thyroid test. And what thyroid test are you going to do? You're going to do a TSH, free T4, free T3, and TPO. The TPO is for the earliest signs of detectable autoimmune disease of the thyroid. In addition, because of its interaction with almost every hormonal system and endocrine system that I know of, use a 25-hydroxy test to test their vitamin D level. I'd say especially here where you have a lot of cloudy skies and overcast skies on a majority of days, you may be lacking vitamin D. People probably don't have enough fish oils in their diets, and so it would be a good thing to do here. And then additional tests for inflammation, you might want to do an eosinophil sedimentation rate and a high sensitivity CRP. In this case, we're not looking for cardiovascular dysfunction. We're looking for other things that may be going on in the intestinal tract. Other things you can do, a blood test for TH1, TH2 dominant. Do just a general IgG and have them split the IgG into 1 through 4s. So you do a total IgG and then do their isotypes of 1 through 4. And if you see the elevations of 1 and 3, you know it's a Th1 type of situation. If it's 2 and 4, it's a Th2 type. Then, of course, IgE is going to be a dead giveaway for a Th2, and the interferon gamma is going to be a dead giveaway for Th1 type of dominance. So with those few tests, inexpensive tests for the most part, you can tell a whole lot about what's going on in someone's situation with autoimmunity, in addition to what you're already doing others. Now we worry. So how are we going to interpret these? Okay, we're going to have a general survey for systemic function, and that's going to be on our SMAC. So our chem panel, our metabolic panel, or SMAC, whatever you want to call it, is going to give us good indication with our BUN and creatinine clearance and creatine. We're going to see the kidney function. We're going to look at the AST and GDT and GDPT and look at the liver function tests. So we're going to have 4 or 5 liver function tests. They're going to be easy to see in there. And then we're going to get some other indications of homeostasis. We're going to look at their fasting blood glucose. And once again, it's going to give us an idea about metabolic syndrome, but it's also going to see how the body is handling blood glucose. We're going to do electrolyte panels and look at our anion gap and total protein to just kind of check the general health, because you may have something else you hadn't thought about. You may have a cancer going on in there. You may have a prostate problem you hadn't thought about. You may have a number of different illnesses you hadn't thought about, a fallopian tube infection, something like that you hadn't thought about. And your metabolic panel should give you some indications, especially when you do a CBC with a dip. Then you're going to find it. So now and the interpretation of the CBC, the complete blood count. So this is information that's, unfortunately, I wasn't taught. I had to teach myself and had to get the references for it. So this is an important thing. If you see the WBC increased, this is often during an acute viral or bacterial infection. So you see the overall white blood cell count is, say, 12,000 when normal is 5 to 10. You're looking at a very mild infection of some sort. If you see the eosinophil increased, you're probably looking at some sort of inflammatory condition. And the CRP is increased, you're definitely looking at an inflammatory condition. If you see for this, and on all these things are involved in the acute viral or bacterial infections. You're going to see increased neutrophils, because neutrophils are the first guys on site for the first 72 hours. So the PMNLs or neutrophils are going to be increased. Lymphocytes proportionally will be decreased during that time, because there's going to be a proliferation of lymphocytes as a percentage of the white blood cell counts. Monocytes are going to be normal, and they're only going to increase later on after 72 hours. Now we're also going to look at we're going to have them do a segmentation on the neutrophils, because we want to know if we have bands or segs in the neutrophils. And the reason we want that is because we're going to tell if they're young or old, whether we have an old or a new infection happening. Now if we have a chronic viral infection or bacterial infection, the WBCs can be decreased. So if normal is 5 to 10, then yours is going to be 5, it's going to be 4, 3.5, something like that. And you're also going to have decreased neutrophils. Why? Because the acute phase is over. There's no need for increased neutrophils now. You need monocytes. You need the big guns to come out. Monocytes to mop up the debris, the damage, to have the phagocytosis, to fight with the big guys, to secrete all those phagocyte enzymes that need to be secreted. The lymphocytes are going to be increased during that time. Phase. You're going to look at the neutrophils carefully, and you're going to get your segs and bands. And if it's more than 2%, if your bands are more than 2%, then you're looking at a young group of neutrophils, but probably you're not. In an old infection, you're not going to look at this. But in an acute infection, you'll see a lot more bands, which means you have a lot more younger cells. Now let's take a look. They call this a banded one because this is a neutrophil right here. You see its size compared to the erythrocytes. Kind of a sloppy stain, really. But then you see this. These are all one. These nuclei are all formed together in this young cell. And then within about a day or so, these guys segment until you have 4 different nuclei inside this neutrophil. And this is a more mature one. You expect these guys to die. These are your pawns. You send them out, you don't expect a lot to return, because most of these are going to get killed in the act of war against these pathogens. And when they're segmented like this, they're the mature ones, ready to go into battle. If they're the younger guys, they're they're corporals and these are more your colonels and majors in here, and in the neutrophil category. So then you do your salivary hormone index and these autoimmune. Remember, we're talking about other things you can do to help to help you better treat your autoimmune patients. You're going to do cortisol 4 times a day, DHEAS, testosterone, the estrogen, the progesterone. You're going to do ratios. And if they do pregnenolone, it's fine. It's not necessary for sure. In addition to that, in order to establish the Th1, Th2 more firmly, you're going to do a 24-hour epinephrine, norepinephrine. And so back in here, let's go back for just a second. Cortisol should be mildly elevated in these autoimmune diseases. If it's normal, you probably don't have enough cortisol being secreted. DHEAS should be well within normal, maybe slightly elevated for the age. And remember, this is age dependent, because after about 20, you start losing DHEAS. And by 65 or so, you only have about 20% of the DHEAS you had at 20. Testosterone should be also well within the normal limits. And testosterone also increase or decreases with age. So you want to use age-dependent ranges on that. So both these should be well within range, because that's going to help, you're going to get a proper Th1 response. Estrogen should be within normal range, so should progesterone and the ratios. Epi-norepi should also be well within normal, because if it's elevated, you're probably looking at a Th2 response, especially if you've got an elevated epi, elevated cortisol, elevated estrogen. You can't help but have a Th2 shift, which means you're never going to get over that autoimmune illness, because you're shifted to a Th2. It's keeping the body from being so active as it would be with a Th1. And the only way, here's the irony, the only way you can have a strong Th1 response is to also have adequate cortisol along with adequate testosterone and DHEA. So in order to kill it, you have to have adequate hormones to respond. Because you have to have those hormones present, not only keep it in Th1 mode, but in cortisol's case, to take care of the inflammation and destruction the Th1 cells are going to cause as they go after these pathogenic cells to kill them. The Th2 is just going to immobilize it. They're going to be like wounding them with arrows. They don't have lethality. They fire the arrow, the antibody from a long way away. There aren't enough antibodies to drag them down for the most part. The Th1 cells, the hand-to-hand combat, are the only guys that could go in and handle these bacteria and viruses and these problems that are likely related to autoimmunity. And there's more and more evidence showing it probably is a pathogenic type of response, is why the body tends to attack itself. The body doesn't just attack itself. There's a reason for it. And the most common theory now is that there's common receptor sites between that pathogen, such as a Yersinia, for example, or a chlamydia. And the body attacks, the immune system attacks cell receptors on common body tissues that look like the cell receptors of the Yersinia or the chlamydia or whatever the thing is. So it's a mistaken identity. That's why the body's attacking itself. And how they know that? Well, if they get rid of the pathogen, then the autoimmunity settles down and then goes away. Second, when you're looking at you did your thyroid test, we should see TSH is somewhere around 2, 1.5 to 2. And then free T4 should vary the same as opposite TSH. So if TSH is down here, free T4 should be up here. And free T3 should vary with it. So if you see free T4 elevated and free T3 down here, you know you don't have cortisol. Because if you had adequate cortisol, free T3 would be higher. Reverse T3, only good for about 24 hours. In other words, The half-life on reverse T3 is a few hours. Pre-T3, the half-life is about a week. Pre-T4, about 2 months. So you're looking at huge differences in the half-lives of these. So you get a relatively short picture on any time you take a blood test and you get reverse T3. Take it with a grain of salt. 2 days later, it might be different. Pre-T3, give it a week to a month. Pre-T4, don't retest before 2 months. 25-hydroxy vitamin D test. Optimal keeps changing. I now see it supposed to be 65. I don't know what optimal is. It keeps changing. I would say anything 42 to 45 is still optimal. You want to have at least 32, but I'd say optimal there. And you have to be careful of the lab that does it because it seems like we're getting a lot of variability now on 25-hydroxy assays. So just be careful about repeatability. One thing you can do is send split samples into the same lab and see what kind of variability you get. So the same patient, send in a day apart or in the same lot with a different name on it and see what happens on it. It's worth the $30 or whatever it costs to do that test. Interpretation of the lab test. With the answers to the above lab tests, we now know some of the indicators of general health and know whether we're dealing with something else more profound than just an autoimmune problem or an intestinal problem, whether there's chronic or active viral bacterial infection, whether there's an inflammatory process in process. We know the relative balance of the steroid hormones, whether it's going to tip it toward a Th1 or Th2. We're going to know whether there's a thyroid or an adrenal problem. And so we know that strong indication of Th, which is high IgG 1 and 3 and high interferon gamma, or if we have strong indication of Th2 activity like elevated IgGs or an elevated IgG2 or 4, that's going to really help us in our treatment protocol and how we're going to get these people well. Combined with what else we know about this person and their illness, this is what we're going to use to get these people well. We're going to take another break now. Back at 4 o'clock sharp, and we'll finish this afternoon. We'll finish by midnight. Good? Probably the most important thing is how do we get these people well? I got to thinking if I were a spiritual healer, I wouldn't need to know any of this stuff. I simply just put my hands on them. They get well, away they go. Wouldn't need to learn biochemistry, physiology, anatomy, any of that stuff. I don't happen to be in that position. I think there are very few people that may have that capacity. But for most of us, we have to learn what we were talking about before in order to get to the final stage, the most rewarding stage, the stage that we trained for, and that's getting people well. So let's look at these one at a time. Let's look at how to treat the intestinal tract. Now notice, these are powerful tools a lot of times, and so if you're working with sick and febrile people, highly toxic people, they'll generally have poorer bowel function than others. So you have to be careful. As they say, start low and go slow. They'll react more severely. They'll take longer to recover from intestinal problems, and you have to be willing to work with them. You have to be willing to let your expectations meet their physical reality. Let's look at treatment of malabsorption. In some people, all you need to do is add digestive aids and have them chew their food. We're not dogs. We need to chew our food. Dogs have very strong digestive enzymes. We don't have such strong digestive enzymes. So the more you chew your food, the easier it is for you to digest your food. And if they have difficulty digesting proteins, we'll know because they'll have more signs after eating meat or concentrated proteins. The food is going to sit in their stomach like a lead ball. It's not going to sit low. It's going to sit high. And they're going to have kind of a lethargy, sleepiness after a high-protein meal. They may have eruptations, gastric reflux, foul-smelling stools because the putrefaction that takes place with bad protein digestion produce a bad-smelling stool. But it's a rotten smell. It's a putrid smell, as opposed to a fermenting smell with carbohydrates. If difficulty digesting carbohydrates, they're going to have symptoms after having meals heavy in pasta or high fiber or carbohydrates or high fiber vegetables. Sometimes with a lot of fruit. Food will sit in the stomach, in the small intestine, a little bit lower. Lethargy, sleepiness after a meal with a high carbohydrate content. And this kind of foul-smelling gas is going to be more like cattle, more like methane smell, a fermentation rather than putrefaction. If they have difficulty digesting fats or oils, it means they lack the pancreatic enzymes, lipase, or the bile that comes out of the gallbladder. And so you'll see fat floating on the stools. You'll see yellowish, tannish, light-colored stools. And you'll know that's due to insufficient bile production. They have the yellowish or tannish stools. So they have oil floating on top, but they have large globules and yellow or light stools is due to lack of bile salts. If it's a tannish or darker brown color, more for the cigar color, but they have small amounts of fat floating on the top and they're smaller globules, then it's probably due to lack of pancreatic lipase. Food allergies. To overcome allergy, the best way to do it is to eliminate the food allergy. Because if you don't, the intestinal tract can't heal, secretory IgA remains elevated, leaky gut can't be made whole, inflammation will still be high, and you have to decrease it. Therefore, successfully balancing and healing the gut is very, very important in overcoming food allergies. So when you're looking at food allergies, it's not just a matter of eliminating the food. You also have to repair the gut, make sure there's adequate digestive enzymes, and there's adequate bacteria, probiotics in the gut in order for the body to respond adequately. The elimination diet is easy, just a rotation diet. Some people can get by with once every 4 or 5 days. Others have a reaction to food 2 years after they have it. You have to ask the patient. You'll have to watch the patient's reaction. If it's people typically allergic to foods they're fondest of, eat the most of, or have a distaste for. So if you use those 3 guiding symptoms, the one they eat the most of, the one they're fondest of, or the one they have a distaste for, those will cover about 90% of your allergies. There's lots of ways of treating them. One is a rotation diet where you eat the same foods only once every 4 or 5 days. That gives the immune system a chance to settle down. There's also the NAET test, the elimination test, where chiropractors and some osteopaths and maybe some nutritionists here do it, where you muscle test, find out the allergy, eliminate that food for 24 hours after a particular treatment protocol, and then you're supposed to be immune to it. There's desensitization drops, where you can have each food can have a desensitizing strength. And so let's just say they're sensitive to eggs. So you have a drop that's 1 in 1,000, and you feed it to them for 2 or 3 days, and then a drop that's 1 in 500, that's 1 in 500 titer, and then a drop of 1 in 250, and then 125. And so when you finally get a 1-to-1, and they don't react anymore, then you know that they've been desensitized to the egg or whatever. There are food allergy injections where you can inject multiple food dilutions subdermally or sub-Q, and do that once a week or once every 3 months, depending on the particular technique. There are nasal sprays that have food allergen desensitization constituents to them, where you simply ingest through nasal passage the aromatic constituents of a food and in a diluted form. if you're doing this, you also need to heal the intestines. Any of these, you have to heal the intestines, because if you don't, you're either going to reoccur that same allergy or you're going to develop a new allergy. Because it's a little bit like after you've burnt yourself, that the skin is more sensitive to burn, so even standing near heat can cause that scar tissue to smart, where it normally didn't do that. The same thing happens in the gut. It's going to be hypersensitive for a while as it heals, and you've got to heal it as completely as possible. You've got to reinvent the gastric lining in some cases and help that brush border be clean and able to absorb nutrients, keep the inflammation down, get the immune system from being overactive, get it calmed down as you go through it. So simple foods, easy to digest, but not refined foods are important. So one of the first things you're going to use is digestive aids, and that's going to help the body digest anything. If they're having any of those symptoms of fats, carbohydrates, or proteins, then use your appropriate digestive aid. Betaine hydrochloride and trypsin or pepsin for the stomach, for the hydrochloric acid, for the stomach, the proteins. Then the lipases, the proteases, or the amylases for the other parts of the small intestinal tract, depending on the signs and symptoms we went over further. Now, intestinal dysbiosis is a little bit more complicated because you've got sometimes food allergies and irritations taking place in the environment of a bacterial disruption. And so there's an imbalance in the bacteria, the wrong kind, especially prominent one or two kinds of mildly pathogenic bacteria. For that, there are 3 products that are really nice. One of them's called Bodyguard, the other's called Squeaky Clean, the other's called Inner Healing. So there are 3 different functions. Bodyguard will kill the pathogen, Squeaky Clean will move it out, and Inner Healing will heal the environment of the intestinal lining. I find this to work really well in intestinal dysbiosis. And the reason for it is because each one of these has a particular need by the body to straighten it out. At the same time, we'll explain a little bit more about those later, but at the same time, we want to have a diet that's high in vegetables, cooked, raw, steamed, steeped, any way that you could cook the vegetables or make them able to be consumed. I notice that people in England tend to overcook their vegetables a bit. So you might want to try some steamed or sautéed, or even in the Southwest, we bake a lot of the vegetables or barbecue them. We put them over an open flame and for a short period of time. It makes them very tasty. So any way that you can cook the vegetable, because each way you cook the vegetable, in some cases it has better nutrients, and other cases the nutrients may not be available. For example, you have a lot of fiber content and folic acid, and the B vitamins and other things are available with uncooked, with raw vegetables, but once you cook them, then you have other constituents like the minerals, and trace minerals are more available from the vegetables than they would be if they're raw. So a variety of cooking techniques gives the best availability of the nutrients in all the vegetables. We want a minimal amount of fruit. We want to we don't want to feed the bad bacteria. The bad fruits, especially Candida. Candida really loves fruit. So if you get cravings for fruit, corn chips, peanut butter, and not like, oh, I like peanut butter. It's like, give me peanut butter. Then you know you may have that. It's a pretty good indication you've got a Candida problem. And when you do a stool analysis, don't be surprised to see Candida come up +2, +3. You want to eliminate all kinds of junk food because that bacteria you don't want in your gut loves junk foods. High sugar content, low fiber, it loves it. Bodyguard, we call it the body's personal bouncer because it's designed to kill the pathogens that are in it. I had it tested by the University of Arizona, and it killed everything that they tested against. Aerobes, facultative anaerobes. It was successful against the pathogen that causes gas gangrene, against the one that causes typhoid, number of different pretty heavy pathogens. The only thing it didn't quite kill was Pseudomonas aeruginosa, the hospital superbacteria, and it inhibited it, but it didn't totally kill it. I'm working on a new formula that will totally eradicate it. It works like a natural antibiotic. It's not as powerful as an antibiotic, but it also doesn't upset the intestinal lining and eradicate the friendly bacteria like antibiotics do. So you take antibiotic at the first sign of infection. It's a combination of colloidal silver and powerful antimicrobial herbs, and you take it at the first sign of infection. It's a combination of Artemisia, olive leaf, uva ursa, oil thyme, oregano, golden seal, cat's claw, black walnut, and each have their own active ingredients. Most of you are familiar with these herbs, along with colloidal silver. You can use it as an aerosol for sinus infections. Simply snort it up your nose. You can use it for acute and chronic infections. There's another product called Nestim you can do that with. I will not travel without Bodyguard. Bodyguard I use every time I just begin to get sick. I take it, and I'm hardly ever ill. You can use it as a prophylactic immediately after being exposed to someone. Someone coughing in your face or whatever. That happens a lot when I travel. It's the best thing. Oh, you can't believe what happens when you travel. Cystitis and urethritis. That's how I first developed. It took me a while to realize how good it was with intestinal problems, because the first ones I used it were I developed it for cystitis and urethritis. I had a family member that suffered from that, and got her out of bed in 2 days, where she had 2 rounds of antibiotics and they hadn't helped her at all. So that's how it started. So it's wonderful for cystitis and senile cystitis. Other uses, we use it for sore throats, fungal infections, topical, fresh cuts and abrasions. Typically 30 drops in juice or water 4 times a day. Take them in her healing, squeaky clean as needed. Take Bodyguard. Other issues, you can take it for infections or intestinal infections. You can have it as a gargle, like it says, cystitis, urethritis. The next one is Squeaky Clean. This is a really unique combination that combines 6 different kinds of fiber. The fibers are listed there. And it contains also a proteolytic enzyme called papain to break down those tenacious mucus deposits you find in the small intestine. And then 3 different kinds of probiotic. The Lactobacillus acidophilus for colonization of the small intestine, Bifidobacterium for colonization of the large intestine, and then Lactobacillus bulgaricus to help seed those 2 above. We find that Lactobacillus bulgaricus works to go before to make a good bed for them to colonate. Just the right amount of FOS to feed the good bacteria, but not enough to help the bad bacteria proliferate. And this allows for a quicker colonization, a better result. In addition to that, it also has slippery elm, ginger root, and fenugreek to help do the wonderful healing that each one of those herbs do to work on the digestive tract themselves. Use it for intestinal dysbiosis. Also, as people fast, it's a nice little detoxifier to use while fasting and to assist in regularity. When you travel and have difficulties with your bowels, it's good to take a couple before you go to bed at night with a glass of water to help normalize the intestinal tract for minor insults and upsets. When you travel, you often don't have a choice about what restaurant you go to, so they take you to something that sometimes you just wonder why it didn't have a skull and crossbones over the top of it. And Squeaky Clean helps me get out of a lot of difficult situations. Squeaky Clean and Bodyguard. Because of its fiber content, because it's replenishing the good bacteria. So we use intestinal dysbiosis as an aid to fasting, to assist in regularity, for aid traveling. And one of my workers taught me that it's a really good aid for antacids. Had a fellow working for us that was taking 30 to 40 Tums a day. And another worker said, why don't you take Squeaky Clean? And when he started taking 2 to 4 Squeaky Clean a day, he eliminated the 30 Tums he'd been taking for the past several years. And it's because that it does that because of the extra hydrochloric acid secreted during eructations, and it absorbs that before it moves through and helps balance the digestive system. So it's high in fiber, but it doesn't produce a huge stool. like other high fibers. It doesn't clog the intestines like some commercial brands might. It's gentle in the action. It doesn't cause cramping. It soothes irritated intestines. It's not habit forming, and it doesn't attenuate with time. In other words, you don't lose the effectiveness with time. Inner healing is one of my favorites. It's a combination of herbs and nutrients especially designed to repair and heal the intestinal tract and mucosa. It's originally developed for intestinal dysbiosis. That's why I particularly developed this product, because it is so elaborate. It needs the intestinal tract needs special attention if you're really going to heal it. Unless the intestinal tract is repaired and made sound, we're really not going to heal these people. We're going to better for a while, but not going to really heal them. And that's what we want to do. Healing, in my estimation, only occurs after someone no longer needs what they were using to feel better. In other words, you're using a particular supplement or a drug or whatever you're using to get you to a certain point of health. At a certain point, you don't need that drug or that dietary supplement or whatever to carry on your life in a normal way. That's healing as far as I'm concerned. And that's my intent with each one of our products. So the intestines will not truly heal and remain a source of constant toxicity unless we really repair them. And we won't get the nutrients we need. We won't get the nice smoothness that the food needs to flow along. And we'll get a continuation of the allergies. They'll go down, they'll come back up until we really heal the intestinal tract. So inner healing is one of the most powerful things that we use. It's a combination of some of the repeat of the others: golden seal, slippery elm, mastic gum, anise, ginger, fenugreek, licorice, echinacea augustifolia, purpura, and then it has some vitamins in it and some particular amino acids that are particularly useful in healing the digestive system. And they're all combined. And I've seen how well it worked. I had one of my family members was one of the people that could only eat 3 foods. And so I started her with using Squeaky Clean and Inner Healing on a combination for about 2 months. And by the second month, she was able to eat a lot more foods. And now it's about a year later, she can eat every food now. And that was a huge testament, because that was the only treatment that she had. So we want to use this combination of inner healing to reestablish the healthy mucosal layer that's coating the stomach intestine, repair that cell lining that often becomes ragged and easily inflamed, restore the protective function these linings have, get that brush membrane up and running again and able to absorb the nutrients, and get the colon so it's nice and smooth, not irritated like it often becomes. So we use inner healing for intestinal dysbiosis, leaky gut syndrome, irritated intestines, ulcerative colitis, irritable bowel syndrome. You'll have significant improvement in at least 80% of your patients. So whenever the GI tract is irritated or inflamed or needs repairs, just simply take 2 caps of Squeaky Clean, and if there's pathogen necessary present, take Bodyguard. And then another immune stimulant we'll talk about in just a moment, NatStem. I take Squeaky Clean with Inner Healing all the time. Need healing? Give it at least 2 months. Sometimes it takes 6, but for 2, they should have a nice difference. And so after this, after 2 months or so, you should be able to repeat the leaky gut syndrome test or the methane breath test, the dysbiosis test. You should see they should come out normal. It's not a matter, you don't have to, you have to, if you look at the lab tests, it should verify what we're talking about. So what about autoimmune disease? There are some promising new drugs on the horizon. You know, typical medical test or treatment of autoimmune disease isn't very good. So this is a guideline, not a prescription, but this will give you some other ammunition you can use for autoimmune disease. You got to ask what disease stage this patient's in, how active is the disease, how debilitating the disease, what's wrong. In other words, you've got to fit your therapy with the person. If they're totally debilitated, you may not be able to get them totally well. There may be too much tissue damage. But if they're only mildly debilitated, you can probably get them totally well. You have to ask them how willing they are to do their lifestyle changes, how willing they are to. If they're not, send them down the street. You only want people that'll work with you. The goal of lifestyle adjustments is to make to create a lifestyle that minimizes the disease process and maximizes the comfort and healing. A lot of lifestyle adjustments. If they're not willing to make lifestyle changes, right away you know they're not a patient for you, because you're interested in getting people well. You're interested in healing. If they're interested in kind of palliative treatment and healing better, just feeling a little bit better, send them down the street. Let them use some cortisol or methotrexate or something like that. Let them go on and lead a crippled life. You're interested in making people well. So the practice is like a garden. You have to weed it every once in a while. We want good digestive function, sound gut integrity, because the gut is the secret to healing people with autoimmune illnesses. So what do we mean by a good food? Low inflammatory diet, high antioxidant content to the foods, high nutrient to energy content, that means no junk food. And if they're allergic to any of these foods, eliminate them. Just because strawberries are supposed to be good for you, if you're allergic to it, they're bad for you. So get rid of it. Just because it doesn't mean they should have it. We use a modified Mediterranean diet with these people because we know that if we have high arachidonic acid, it's going to make them pro-inflammatory, so no red meats for these people. Small amount of fish and poultry, lots of vegetables, a little bit of fruit, low glycemic index, typically 70 or below on the glycemic index, and we're going to use monounsaturates like olive oil or coconut oil in their foods. We're going to use foods that are free of chemicals and sprays because they're going to be more vulnerable to that. Prepare and cook their foods with olive oil, grapeseed oil, or coconut oil. We're going to avoid trans fatty acids because omega-3, 6, and 9s that we need. And foods that are especially good to increase methylation. Spinach, garlic, fish from deep waters, such as hoki oil or sardines from Norway, chicken, corn, Brazil nuts, cashews, pistachios, and some of the beans, kidney beans, black turtle beans. Those are all methylators. Here's a basic look at the Mediterranean diet, but no red meat. Basically allow no junk foods. And avoid NutraSweet. I'm not going to go into the details. Let me tell you, it's no good for people with autoimmunity. It causes them to get worse, and it damages their system. Want to chew the food times a mouthful. Take digestive aids whenever they need it with people with autoimmunity. And in most cases with autoimmunity, they're going to need bodyguard, squeaky clean, inner healing, and NatStim. NatStim is an immune enhancer that works with both cellular and humoral immunity, but makes sure they stay in balance with each other. It's a wonderful healer that comes out of Bulgaria. If the vitamin D test is low, first give them vitamin D. About 10,000 IUs for 3 months and then retest them. If the test comes in the normal, cut it down to 3,000 and 4,000. Hoki oil or other kinds of fish oils that are in the 4-to-1 DHA to EPA. So the 4 is the DHA. Now most fish oils are going to be EPA 3 or 4. We want DHA to be 4 and EPA to be 1 on these kind of fish oils that are going to work with autoimmune people. NatStim is an immune enhancer. It's actually it's a fortified Lactobacillus bulgaricus, but it's been fortified for the immune fraction portion of it. They worked 18 years to get this in Bulgaria, and they finally got it. And so it's a very powerful strain of Lactobacillus bulgaricus johnsoni. And it the only one I know, the only dietary supplement I know that kept government records for 18 years, and they've got no adverse reactions. They gave mice and rodents 5,000 times the usual human dose, and at the end of that 4 months, the only thing they had were healthier animals. You can use it as a treatment. It's worth best as a prophylactic. So you simply take 1 or 2 a day, and people just quit getting sick. That's usually what happens because it slowly raises the immune system, both humoral and cellular immune system, and people just start responding much differently to colds and infections. Easy to use, can be used by any age. I can put this down children as long as we can sprinkle it on their food. I asked the developer of it, a scientist, a WHO scientist, I asked him how young you could be to take Nat-Stem, and he says, oh, I think under a few months they might choke on the pathway. So ours comes in capsules. You can sprinkle it on their food. So it will elevate IgA, IgG1 through 4s if they're depressed. If they're elevated, it'll bring them back down. It does not affect IgE function, so you won't get an autoimmune type of or an inflammatory type of reaction. It helps Th1 responses, but only helps them to the point where they balance it, not to the point where they become destructive. Use it for overall immunity. That in parts of Europe, it's been used for over 18 years with no adverse effects. And when they gave it to their workers in Bulgaria, they cut their absenteeism due to respiratory infections by 80%. So we use Nat-Stem in our household, and I have thousands of people that use Nat-Stem every day. You just simply take 1 a day, and that's all they do. If you happen to have an autoimmune disease, then I use 2 a day if they have intestinal dysbiosis, irritable bowel, or Crohn's disease. You can use it for otitis media, too. That combined with an anti-inflammatory for the gestational tube and taking them off of dairy food is usually all I use with children anymore. Daycare workers and people exposed to people like healthcare workers should take it every day. It'll end up being like a little shield for you. If you do happen to get sick, you won't get nearly as sick. You'll bounce back faster. Now remember that we have an adrenal problem, most autoimmune difficulties with a lot of gut problems, and we have our own separate metabolic issues with the adrenals, the gut, the immune system. So we're going to emphasize most of the book. Most of it applies to metabolic syndrome as well as adrenal fatigue. And we're going to replenish the depleted nutrients, normalize blood glucose, normalize adrenal function. Lifestyle disorders, what we're going to do with metabolic syndrome and adrenal fatigue is we're going to try to decrease excessive stress, increase the lack of exercise. We're going to try to make better food choices, eliminate caffeine or minimize it at least, and make the calories more appropriate to their intake. Specifically for metabolic, what we do is decrease insulin resistance, increase insulin sensitivity, normalize our lipid levels and weight levels. We're going to do this partly by dietary things, partly by dietary supplements, and we're going to decrease cortisol levels back to normal. In some cases, we'll even reverse prediabetes and diabetes. And, of course, we should improve cardiovascular health and take away those pro-inflammatory events. With adrenal fatigue, the big goal is to get cortisol levels up to normal, not down to normal with metabolic syndrome. We're going to normalize their blood sugar levels and normalize their adrenal function. So look at them side by side. Metabolic syndrome, we got high cortisol. Adrenal fatigue, low cortisol. Metabolic syndrome, high aldosterone. Adrenal fatigue, low aldosterone. Metabolic syndrome, high sodium. Low sodium over in the adrenal fatigue. Opposite potassium, low potassium over here. High potassium over here. High blood sugar on the metabolic syndrome. Low blood sugar on adrenal fatigue. We got fluid retention on metabolic syndrome. Mild dehydration taking place in adrenal fatigue. Abdominal adiposity here. You can have any body type and have adrenal fatigue over here, including abdominal adiposity. We didn't get a chance to talk about it today. Lifestyle change to do anything we can to decrease their tension, minimize the stress in their life, get some sort of relaxation, breathing exercises, laughter, anything to get stress off of these people. Locate the energy robbers in their life. Who are they? People that suck energy from them. That's how you know the energy robbers. You feel worse after you're around them 5 or 10 minutes, or even talk on the phone to them. Get rid of them. Have them get rid of them. Unfortunately, it's a relative. Oftentimes. So you have to minimize that contact. So I've written scripts that says, you're not allowed to talk on the phone more than 5 minutes to your mother once a week. And what does that mean? Well, it gives her that power. There is this power greater than me, my doctor, who won't let me talk to you as part of my therapy. And you can use that script as a shield to help that person get better. The book has a lot about reframing techniques, attitudes, how to change your attitudes. The glass is full or half empty. It makes a lot of difference in the stress, how you experience stress. If I tell you we're going out this door, someone's going to give you a check for £1 million versus someone's going to stab you with a lawsuit as soon as you get out, there's going to be a big difference in your cortisol response. And if you wake up every day reframing it so that you can see that you have a very different attitude, something good may happen to me today. I can't wait to see what's going to happen to me today. That's so much different than, oh God, the sun came up again. Isn't it? So we want them to learn to expect something good to happen daily, because good things happen to us every day, whether we recognize it or not. We're going to exercise them 3 to 5 times a week according to their levels. If it's a week, we're going to lay them down. If they get tired, we're going to rest them as much as possible. We want them to get into bed early, 9 or 9:30. We don't want them to get into that 11 o'clock second wind. And whenever we can, let them sleep again until 9 o'clock in the morning or later. Exercise. There's benefits of exercise. With benefits of exercise for metabolic syndrome is we want to decrease cortisol and insulin resistance and glucose and burn some calories to get some of that weight off. And so we want these people moderate exercise 30 to 40 times a minute as much as they can without causing embarrassment, and exercise to comfortable capacity. Different exercises on varying days so they don't get bored, and get flexibility as well as metabolic enhancement. With a we mainly want them to increase some sort of capacity. And we use a criteria of not too much. If they get more tired after they've exercised or they're more tired the next morning, they've overworked. And so they have to do it in retrospect. If they saw they were too tired doing this kind of exercise, they do less of it or they eliminate it. So they can do anything they want to. They just watch. Were they more tired within an hour and a half after exercising, or were they more tired the next morning? If they weren't, go ahead. Let them exercise as much as they want. We do want them to avoid competitive sports because it's too much. It's too draining on them typically. We don't want them to push themselves, and we want to try to get them to enjoy, because enjoyment is very important with people with adrenal fatigue. Enjoyment. In these cases, we want the exercise to raise their cortisol levels. Remember, metabolic syndrome, we want to decrease the cortisol levels. And exercise, moderate exercise, will do both. Moderate exercise will decrease elevated cortisol levels and increase low cortisol levels. We want to increase the glucose by normalizing the glucose, and we will if we increase their cortisol levels. We want to normalize sodium, potassium levels, and then modify their diets. Now, this is a typical diet for most people. They live on drugs. They down it with pizza and beer. They keep themselves going with coffee and beer, and then every once in a while they treat themselves to fast food. I know that it's a little jaded look, but people don't have very good diets, and we just learned that people now get more of their calories from soft drinks than any other source in the U.S. at least. I hope they don't care. We want to emphasize foods that nourish, of course, and minimize foods that deplete the food, of course. And so, in both of these cases, we want to look at foods that are more the 15-to-1 sodium to potassium ratios. We want to avoid foods that they're allergic to or sensitive to. We want them to have regular meals because it's going to keep their blood sugar more steady. We want them to chew food 30 times a mouthful because it's going to help the digestion. And of course, we're going to limit foods. We're going to eat food as natural and fresh as possible. Keep their carbohydrate in low. They're going to eat low on the glycemic index for both metabolic syndrome and adrenal fatigue. They're going to eat proteins at every meal. They're going to balance sodium potassium intake with their foods, and they're going to avoid those junky trans fatty acids, hydrogenated, partially hydrogenated oils, as well as caffeine. So here's your difference in the diets. Both of them high protein, metabolic, high meat, high white meat, and vegetable protein. Adrenal fatigue, high red meat. Low sodium, high potassium foods, a lot of vegetables, a lot of fruits over here. High sodium, low potassium over here. Abundant vegetables over here, abundant vegetables over here. Both low glycemic. We want a low fat and oil content on the metabolic syndrome because we don't want the calories. Over here, a high fat and oil content as long as they're not overweight. Over here, low calorie diet. Over here, no calorie restrictions unless they're overweight. We want the people with metabolic syndrome to eat and quit before they're full. About 70%. You know the Chinese proverb that the first 70% is for the person, the last 30% is for the doctor when you're eating. We want to eat with the people with adrenal fatigue. It's important when they eat, not just what they eat. Because they tend to be hypoglycemic early in the morning, we want to eat before 10 o'clock and again before noon. Bang, bang. We want to eat only when hungry with a metabolic syndrome, and we want them to quit. We want to eat before they're too hungry so they don't overeat, and we want them to undereat a little bit. We want to eat small, regular meals for the people with metabolic syndrome and avoid foods that stimulate the insulin and blood sugar. And the meal should emphasize the low-calorie, low-glycemic index. We eat with adrenal fatigue, however, it balances the body. They may have to eat 5 times a day with 4 or 5 bites at a time. Or they may get by with 3 or only 4. We want to avoid fruits in the morning because it makes them feel worse. And we don't want them to miss meals. We want those meals to be very regular because their blood sugar tends to be irregular. And the more irregular the food intake, the more irregular the blood sugar is, and the more it plays havoc because hypoglycemia itself is a stressor and causes more strain on the adrenal glands. We want the meals to emphasize proteins and fats and unrefined carbohydrates all together, all 3 at each meal, because it gives a better energy, a steady energy to keep them going through the rest of the day. Generally, what is food? We want them to have food. Food is what grows into, out of, or runs around on the ground or is taken from the water. So if it looks like this, it's probably food. If you don't recognize it as ever growing or running around on the ground, it probably is not food. So we want people to eat food. That's what's going to get them well. One of the biggest things, support food. Remember, they're dietary supplements. They supplement the foods. You need a good basic diet before you're going to get someone well most of the time. So we want to eat the low-cal, high-nutrient foods, not easily converted to glucose. Metabolic syndrome, we want a high potassium, low sodium. Foods that don't stimulate cortisol production, so stay away from caffeine and insulin-stimulating type foods, which basically is caffeine and refined carbohydrates. So no white flour, no white sugar, and no caffeine. Eat smaller portions, chew them well, consume fewer calories. Adrenal fatigue goals, eat before 10 and again by noon. Avoid fruit in the morning. Combine good quality oils, fats, unrefined carbohydrates, and proteins at every meal. And add salt whenever you feel like it, including adding salt to your water if you want. If it tastes better with salted water, drink it, because you probably need it. Lifestyle includes an important part. If you don't take care of the diet and the lifestyle, you're probably not going to get these people totally well. You use that as a base, however, to use your supplements. And what are we going to use here? We're going to use good sugar for metabolic syndrome to normalize the sugar, the blood sugar. Supraadrenal stress formula, the nutrients you're probably familiar with that contain all the nutrients to balance the cascade. In this case, we're going to use supraadrenal stress formula to replace the nutrients they're burning out by the overactivity of cortisol. In the adrenal fatigue case, we're using supraadrenal stress formula to help them feel better and feel better balanced to be able to conduct their day better. So the good sugar on the metabolic syndrome is going to get their blood sugar down, is going to get them feeling normal, help increase insulin sensitivity, decrease insulin resistance. Over on the other side, we don't have that problem. So we're going to use adrenal rebuilder, which is a glandular extract, to do the healing, the deep healing of the adrenal gland. Both of them require adrenal C on the supraadrenal, on the metabolic syndrome side, because they're burning up C like crazy, trying to lead their pedal to the metal life and their overactivity. Over on adrenal, we use adrenal C on the adrenal fatigue side because you need a lot of C to rebuild the glands, especially the adrenal gland and the rest of the tissue, to overcome the effects, the ravages of stress. You can use as a substitute a powder that becomes a liquid, and when you put it in liquid, Dynamite Adrenal, that has a lot of the nutrients that are contained in those products that are above. And it's a good substitute for people on the run or in a hurry or as a mid-morning pickup or an afternoon pickup, or people get tired of taking pills for a while. You can use the Dynamite Adrenal as a substitute. It's a pleasant tasting powder. Then as a way to balance the HPA axis, if they have hypertension or borderline hypertension, use herbal HPA, which is a combination of maca, Siberian ginseng, and ashwagandha. And that balances the HPA axis, decreases perimenopause, menopausal symptoms, helps people sleep at night when they take 30 to 40 drops at night, and then helps them maintain during the day better. If they have adrenal fatigue, the same formula plus licorice is called herbal adrenal support formula, because one of the things licorice does is block that 11-beta dehydrogenase activity, so you get more cortisol instead of cortisone. And so licorice helps prevent the cortisol going to cortisone, so you end up with higher circulating cortisols. You don't want the licorice in metabolic syndrome because too many of them have hypertension, and too much licorice can elevate the blood. But people with adrenal fatigue usually have low blood pressure, so that's not your problem. Usually you want to elevate the blood pressure a little bit. So good sugar, as we've talked about, normalizes insulin resistance and sensitivity, balances blood sugar, basically helps blood sugar remain normal, and people get off this horrible insulin resistance problem that they have with metabolic syndrome. And because it contains magnesium, chromium, manganese, vanadium, and zinc in the combination, a beautiful combination of herbs that create insulin sensitivity and normal utilization of blood glucose. It's going to help modulate blood sugar during stress, increase insulin resistance, restore insulin sensitivity that we see so often in chronic stress and elevated cortisol. When you have diabetics and you use good sugar, be careful, because starting about the second month, they may need less insulin. We've had a number of cases where they started out with 400 or 500 units of insulin, and over a period of 3 months, they dropped to 100 units of insulin, because there's so much regulation that happens with the good sugar that they don't need the insulin like they used to. And in some cases, they've gotten off of it completely, depending on how good their diet was and how severe they were to begin with. It's very powerful, and just wanted you to be sure to watch that. Make sure they watch their insulin intake and their blood sugar. So we use it with all people under metabolic syndrome, people under stress that are having blood sugar irregularities, prediabetes, diabetes, hyperglycemics, anyone that's having difficulty with their blood sugar. Even if the blood sugar is going up and then down and up and down, up and down, it seems to be really useful for that, as a matter of fact. And people that have these insatiable sugar cravings, we found that good sugar is really good to take away those insatiable sugar cravings. Now, if it's due to a candida problem, they'll also crave peanut butter or corn or other things like that in addition. But if it's only due to blood sugar dyscrasia, then good sugar will be excellent to deal with. Simply take 2 tablets in the morning and one before bedtime. Or if needed, if the blood sugar is elevated in the morning, take 2 in the morning and then 2 before you go to bed. That's simple. We pretty well covered this. The supraadrenal stress formula has a lot of, because those are all NADPH pathways. Remember that? They take a lot of niacin. They also have to have a lot of B6 because of the transaminations and the hydroxylations that are taking place in the adrenal cascade. So you need a lot of B6. You need a lot of pantothenic acid to start the ATP formation inside the cells. And this is put together in a combination that helps people balance their adrenal function but doesn't make them feel speedy or rushed. It makes them feel balanced. And then in addition to that, there's trace minerals in there that are used in the adrenal cascade. As a final topping on this, both the adrenal C and the supraadrenal stress formula are sustained release. So you get a 4 to 5 hour release, and that's very important in water-soluble vitamins because otherwise you get a peak and valley effect. In other words, they're quickly absorbed in the intestinal tract, but the kidney responds and quickly pees them out. So high-potency water-soluble vitamins have difficulty reaching the tissues in high quantities because they get peed out very quickly. With a sustained release like this, you get a nice steady increase and allows a nice beneficial, calm, soothe, but energized effect with people with adrenal fatigue. And then it replaces the B vitamins being burned out and lost with the people with cortisol problems of metabolic syndrome. Depends on their severity and the problem, but for metabolic syndrome, simply take 1 to 3 a day. Even someone who only has a stress lifestyle and doesn't have metabolic syndrome, we want to prevent them from burning out. And this is probably one of the best ways we do it, is replace these nutrients before they get a chance to get into the bottom. If perchance someone gets speedy under this, it means they're taking too much, because that's not the objective. So we decrease the dose, and if they have difficulty sleeping, don't have them take it after 6 o'clock at night. Now, adrenal C, vitamin C ever formulated for the adrenals, and it's for several reasons. One is it has bioflavonoids and ascorbate ratios. It's in portion of how it's found in nature. About 2 ascorbates for every bioflavonoid. Has sustained release, pH balance, and so you get the pH balance because people with adrenal fatigue are too acidic. And if you just add ascorbic acid, you're going to make them more acidic, and they're going to pull magnesium and calcium out of their system in order to balance it. So we add a pH balance, and we balance it with the trace minerals you're going to need in the adrenal cascade anyway. And then we sustain and release it to make sure you get maximum absorption. So it's quite a sophisticated vitamin C. So what happens in metabolic syndrome? It helps reduce glucose, sensitize insulin, reduce glycosylated hemoglobin, as you know, is very important. So after 3 months on this therapy, retake their glycosylated hemoglobin, should be coming to normal. Of course, we know vitamin C has beneficial cardiovascular effects, especially with the bioflavonoids in there. And then any kind of stress, you need more C. Any kind of tissue damage, you need more C to repair. Vitamin C also acts as a regenerator of vitamin E and coenzyme Q10. So we use vitamin C in metabolic syndrome as a regular supplement because they're burning up a lot of C with their stress, as an aid to overcoming the allergic reactions that happen with metabolic syndrome. We use it as the most complete supplement that we know, the most complete C that we know. And also, it's one of those very, very few C's that doesn't burn your stomach when you take it. A lot of people have trouble with that. You shouldn't have trouble with that in your patient. Typical dosage for adrenal C, 2 to 4 a day. Stress lifestyle, the same. Adrenal C for normal activity, just 1 to 2 a day as a regular replacement for vitamin C. Animals make about typical 3 grams of vitamin C a day equivalent to us. I've talked about herbal. And now as far as dietary supplements, very quickly, I'll talk adrenal rebuilding, glands of hypothalamus, adrenal, pituitary, and gonadal tissue. It's hormone-free. I want to repeat that. It's hormone-free. We don't want the hormones in it. If I'm going to give a hormone, I want to know how much hormone I'm giving. And so these are designed to heal the gland. They're not designed to give a hormonal boost. So you can take half a bottle of this and you won't feel anything. The idea is to heal the tissue. And how do I know that? Because I've eaten a half a bottle before to see if I could get anything. And I don't. And I don't want it because I want a steady healing. I want the building block to rebuild my glands, the HPA axis that Adrenal Rebuilder has. These are from a porcine source because the literature showed the porcine was more effective than bovine. These particular pigs are allowed to free range. They're organically grown without sprays and chemicals. And we only use the cortex. We don't use the medulla. So you never have to worry about a jitteriness from these. First was right here in London, England. 1896, use of adrenal glandulars, a little company called Burroughs Wellcome. And now it's, was it Smith-Glaxo-Klein now? Is that who Burroughs Wellcome is now? Yeah. And another company, Oppenheimer and Chase Rainey. In the adrenal, and by the 30s, it was being used by a lot of physicians. A lot of physicians use this adrenal glandular to heal their patients from hypoadrenia and other kinds of names for low adrenal function. We use it to recover from adrenal fatigue, to repair the damaged adrenal gland, basically to do that repair that's very, very difficult once the adrenals get damaged. And give it to children. Typically, I give children one tablet if they're under 40 pounds. Under 80 pounds, we give 2 a day, and over 80 pounds, treat them as adults. You can crush it and put it into foods for a child. You have to keep it out of pets. Pets will glass to get to this stuff. So if you have pets or your patients have pets, be sure to keep them in a well-contained area because pets will climb up on counters to get this. A mild adrenal fatigue, simply take 4 a day, moderate 5, severe 6. Talked about supraadrenal stress formula. In this case, you're using it to replace the cascade, to push the cascade to become more normal until Adrenal Rebuilder can heal. So they'll feel better faster with a supraadrenal stress formula, a lot faster than if you just do Rebuilder. But it won't do the deep healing that Rebuilder does. So you need both of them with the adrenal fatigue. And of course, you need Adrenal C, and they feel a lot better if you use a herbal adrenal support formula with them. You can use it indefinitely too. You don't become addicted to it. You don't have a big letdown if you don't take it. It's just a matter of making everything work better, especially with people with adrenal fatigue. Oregon with it. I think I've covered these, except that if they have PCOS, then use this formula because it has the licorice in it, and it's shown that licorice is a specific for PCOS to help women with PCOS. But it's probably the best thing. The herbal adrenal support formula is probably the best thing I see for helping PMS and perimenopause and postmenopausal women very quickly. Now, the supraadrenal stress formula and adrenal rebuilder help a lot over within 3 to 4 weeks. But if you want an effect in the first week or so, herbal adrenal support formula is the fastest way to help balance that HPA axis and get them feeling better during that time. And like we talked about before, Dynamite Adrenal is a powder that contains all the different nutrients that are in the supraadrenal stress formula, adrenal rebuilder, adrenal C, and herbal adrenal support formula. But it's a high fiber combination of nutrients. It's a powder that people can put into a shake or a smoothie. They've got 2 minutes to eat breakfast. They can put it in the smoothie and drink it while they're going down the road. They're probably driving and doing their nails at the same time. These kind of people. Use it to as an afternoon pickup or an early mid-morning pickup. or occasionally as a substitute. I think it's more powerful to use the tablets to get people over adrenal fatigue. I don't think there's any question about that. But once in a while you get people that have difficulty taking tablets early in the morning or they get resistant. Dynamite Adrenal is a really good way to go to help them still get the nutrients and get it down and at the same time have a pleasant way of doing it. Also for the pills, occasionally if it upsets people's stomach, you can use Adrenal as a substitute for that too. It's a non-caffeinated energy drink when food's not available. If you're traveling or camping or just stuck in a bind, the combination of that and one of the handshakes makes it very easy to consume and acts as a nice energy stabilizer and pick-me-up. So basically, anyone can go with metabolic syndrome, adrenal fatigue, who can't take the pills, as a substitute, as a nourishing drink for adrenals instead of pills, and people with adrenal fatigue who suffer lows in the mid-morning or afternoon to use as a supplement. That's when we use Adrenal, Dynamite Adrenal. 1/2 to 1 scoop, and supplements you can look at. I'm going to skip that to the questions. So here's kind of a summary sheet. Metabolic suggests a protocol to reduce insulin resistance, take good sugar, herbal HPA, and supraadrenal stress formula. Elevated cortisol, we want the above and then add about 200 milligrams of phosphatidylserine before bedtime. If they have dyslipidemia, we're going to use the same formula as above, except we're going to add fish oils and antioxidants. If they have hypertension, we're going to be the same above, and we're going to add magnesium and calcium at different times of the day. And do the same thing with impaired fasting glucose. With diabetes, we're going to do the same thing, plus use whatever medication is necessary. And cardiovascular disease, we're going to use the same thing, except we're going to use chelators, vitamin K2, and other things such as nattokinase that are cardiac-specific treatments. Adrenal fatigue protocol is very simple. We use adrenal rebuilder to deep heal the adrenals and the HPA axis, supraadrenal stress formula to get the nutrients to make them feel normal, give them the energy, keep them steady. Adrenal C, because the adrenals need a lot of C, more than any other organ or gland, and also to heal tissue while they're recovering. We're going to use herbal adrenal support formula to keep them steady, balance the HPA axis, make them feel normal. It's good about removing depression as well as perimenopause, menopausal problems. And then Dynamite Adrenal as an energy drink and a substitute for the pills when they need it. That's kind of a whiz-bang summary. And I want to summarize now what we're talking about with metabolic syndrome and adrenal fatigue. Both metabolic syndrome and adrenal fatigue are in epidemic proportions in our country. It's a shame. We've gotten ourselves into this situation with our stresses. But we need to get it back. And it's going to be practitioners like you that are going to do it. Medicine's never doing it. They're under a hypnotic spell of the drug companies. They're never going to get free of it. They're too much involved in it. You're going to have to be the ones going to lead it. And I know you're the ones because you're the ones willing to spend a Saturday educating yourself, learning more so you can help your patients. You're the dedicated docs. You're the dedicated nutritionists that are going to lead the way to help these people get back to their health. And we have an entire country to get healthy again after the stresses that people have endured. Neither metabolic syndrome nor adrenal fatigue is widely recognized or adequately treated by the healthcare profession. And both high and low adrenal functions affect the cardiovascular health due to changes in the vasculature and the fluid dynamics. So when you're treating for metabolic syndrome and adrenal fatigue, you're saving lives. You're not just making people feel better and look better and have better energy and sleep better and be able to work better and have less family conflicts and be able to feel better about themselves. You're going to reverse things you didn't even know exist. Cardiovascular illness, possibly cancer. Both adrenal fatigue and metabolic syndrome can be treated, luckily, by a combination of lifestyle changes, proper nutrition, and the correct dietary supplements. There's a lot of them out there, but I'm telling you, only a very few of them work. Both of them take time to heal. You got to give 1 year to 2 years before these people are going to reverse on you, but they're going to be feeling better after just a few weeks if you do the right things. Both can dramatically be affected and even reversed by proper treatment. And that's one of the most beautiful things. As bad as they are, you have the power from what you learned today to reverse both these conditions in a profound way. So the healing is not only possible, it's likely when you're using the proper treatment protocol we talked about today. And isn't that invigorating to know that you're going to be able to help so many people with their health? You're going to be able to reverse so many different conditions, and the people will never even know they ever had them or on their way to them once you have a good idea about this. So what I suggest to you is go over these notes, go online and review this presentation so you can help these people as much as you can. And then hopefully I'll come back another time and we can talk about questions you might have, or I'll answer your questions online, and we'll talk about other subjects because we only scratched the surface today. Believe it or not, we just got past the surface again. But you're the kind of people that I enjoy talking to because you are the docs and the nutritionists and the therapists that are willing to spend the time and the effort with yourselves and with your patients to get people well. So I applaud you, and I thank you for coming out today. Hold on. Have a seat.
Just to mix your onion and blood. I can tell the students I can use really easily. Now, whilst actually just doing